Hi, Dr. Ryan Stratford, a urogynecologist at the Women's Center. I'm going to speak with you a little bit today about urinary tract infections. Urinary tract infections are one of the most bothersome problems women experience in their life, and sometimes more frequently later in life. I'm going to speak to you a little bit about how that occurs and how we treat it. The two most common causes for having urinary tract infections are changes that occur within the vagina that typically happen after menopause or later in life, and or not emptying the bladder completely. Let me show you how that looks. So if you take a look at this diagram, you have an idea of where the bladder lies. You can see the bladder lies very close to where the vaginal canal is. Here's the uterus, here's the rectum. When there's changes in the vagina, it allows for bacterial growth to occur that is not healthy. That bacterial growth will allow for bacteria to work its way into the urinary system. That bacterial growth occurs naturally. However, after menopause, when the changes or decrease in estrogen cause changes to the vaginal wall, the acid level within the vagina changes and allows unhealthy bacteria to grow there. The unhealthy bacteria comes from the rectum. It'll work its way into the vagina and it'll live there. It will not cause a vaginal infection, so it's not dangerous, but it will continuously try to re-enter into the urinary system, and then you can develop a urinary tract infection. We can treat the vagina with medication. There's different medicines that have been developed. The most effective is just estrogen itself. And using it in this setting is very safe. It requires a prescription, but it can be inserted into the vagina once a night, usually for 2 weeks. And then after that, only about twice a week is needed to maintain normal health of the vagina. This is a tube of that cream. It's a cream, so it's placed either into a dispenser like this that's then inserted, or it can be placed on your finger and then placed within the vagina. This shows the amount. It's not very much, just this small amount, like a very large blueberry size, and then it's placed internally with the finger and then left there all night. It absorbs and then it starts to change the environment, actually changes the characteristics of the vaginal wall. That can help significantly with reducing the risk of urinary tract infection. Now, after doing that, even if there's ongoing infections, it might be because the bladder's not emptying all the way. The bladder may not empty sufficiently because the outlet might be obstructed. And that can happen when the vaginal wall falls, called prolapse. Or it may be because the bladder muscle's not squeezing well. Or there may be other reasons why it doesn't empty completely. To learn about why the bladder doesn't empty well, we have to do more extensive testing. Not too complicated, but tests that show us the pressures the bladder generates and why it's not emptying well. Solving that problem is critical. Once solved and the bladder empties completely, urinary tract infections go away. If you'd like to learn more about this, I recommend going to our website, thewomenscenter.com, or reaching out and scheduling an appointment to see a subspecialist in urogynecology like myself. There'll also be more information on my YouTube channel.